Good morning, everyone. It is Tuesday and January the 12th. It's 9 a.m. here in Cleveland, Eastern Standard Time. My name is Ashok Agarwal. I'm your host for the next 2-3 hours. And I want to, first of all, before we begin the program, want to wish you a very happy New Year 2021. I wish you good health and a lot of happiness, and I hope that we will be able to see many of you during this year after the pandemic is under control. So thank you again. And today is a very exciting program. We are here to discuss and present virtually our online ART training. Today is the third program in the series. We began in November. We presented first program in November, then second one in December, on December 8th. And today is our third program on January the 12th. Today's program is on Ancillary Semen Tests. So let me begin without taking any further time and begin my introduction. Very briefly, this is my biography, a very brief biography, just to provide few highlights. I am in charge of the Andrology Center at Cleveland Clinic for the past 28 years. I'm the director of the American Center for Reproductive Medicine, which is the host of this online virtual training session. I'm a professor of surgery and urology at the Lerner College of Medicine at Case Western. I'm a staff in urology and in some other department. Our group is very well known in the area of male infertility, andrology, and human-assisted reproduction, and we are ranked as #1 in terms of our publications based on the Scopus, which is one of the premier service in terms of the literature in the medical field. Our group has published a very large number of books in the field of male infertility, ART, fertility preservation, DNA damage, and antioxidant. Our laboratory has trained over 3,000 scientists, clinicians, graduates from more than 100 countries. The organizers and speakers of this program have no conflict of interest. We have taken no sponsorship or asked any company for that. This program is made entirely possible by the support from our foundation, from our own center, and the webcasting support has been provided by our colleagues, David Reichling and David Wolfley. Course faculty have generously donated their time for this online training, and our program coordinators, who you will see in a minute, have graciously volunteered their valuable time to manage this program. Lastly, the names, images, and description of products or instruments that you may see during the lectures or which will be discussed during the presentations are not being endorsed. They are being used routinely in our program. So this is today's program. The learning objectives today is we have a very, very good program today, and you will see this is part of the semen analysis, and it is like a hidden gem. Most people will not know many of these tests that are basically done as part of semen analysis as indicated. So we are going to discuss about the leukocytospermia or detection of white blood cell or infection, sperm vitality testing, anti-sperm antibody screening, special test for azoospermia, post-vasectomy screen, and screening for retrograde ejaculate. So I can tell you that today's program is by far going to be the very best. We have invested enormous amount of time in preparing for these lectures. They have been well researched, well prepared, and practiced dozens and dozens of time what you are going to see today. So for each lecture, we have spent almost 30, 40 hours minimum in practice sessions. And each lecture has gone through at least 10 or 12 practice sessions with multiple people. And each content has been well researched through the literature with proper references, and to make sure everything is extremely accurate and simple for you to understand. So this is our program today in a diagram. As you can see, the last lecture is going to be by our clinician, who's going to really put it all together to explain what these tests really mean to you. And Dr. Sharma is an associate professor at the Lerner College of Medicine at Case Western. He is the coordinator and assistant technical supervisor within our andrology center. He has been with us for over 26, 27 years, and he has done a lot of research. As you can see, he has received several awards, and he is an excellent andrologist in his own right. So today, I have asked Rakesh to present this presentation on sperm vitality. So let me begin, and I'll ask Rakesh to begin his presentation at this time. So Rakesh, you can begin if you are able to.
Thank you, Dr. Agarwal. Hello, everyone. The topic of my talk this morning is sperm vitality. Next slide, please. The learning objectives will be to understand the differences between sperm vitality and sperm viability, learn step-by-step protocol to conduct this test, understand the quality control associated with this test, define the normal and abnormal results, and look into the clinical correlation and the therapeutic application of the sperm vitality test. And at the end of my talk, I will provide you with some important takeaways. Next slide, please. It is important to differentiate between live, non-motile sperm and dead sperm. And also, it is important to understand the difference between sperm vitality, which essentially refers to the integrity of the sperm membrane, and sperm viability, which refers to the percentage of live sperm in the semen sample. Both terms are frequently used and interchanged, but I want to highlight that this is not correct. Both terms, they are different and distinct. The only common thing between the two terms is that they both indicate the function of the sperm membrane. On to your right is the protocol for conducting this test, and this protocol was shared with all of you. Next slide, please. The test for sperm vitality is the eosin-nigrosin staining, and this must be conducted on all specimens having a motility of equal to or less than 40%. And this test is done immediately following the initial examination of sperm motility. And this is important because any delay in conducting this test can result in deleterious effects because of the dehydration or changes in the temperature. Eosin-nigrosin is a common test, but there are other tests available such as the trypan blue, propidium iodide, and the Hoist stain. Again, on the right is the protocol or the brief protocol that was also shared with all of you. Next slide, please. The principle of the eosin-nigrosin staining for sperm vitality is based on the cell membrane exclusion principle. And what this means is that if the sperm is intact, the stain cannot penetrate the cell and the sperm will appear white. However, when the sperm is damaged or the membrane is damaged, the stain starts to enter the sperm and the sperm head will stain and eosin will be shown in the sperm as a pink color stain. And on to the right are the the stains showing the vital sperm, which is not stained, appears white, and the stained sperm, which appears pink. Next slide, please. It is important, as I mentioned, to know that the sperm which are immotile, are they alive or dead? And this is examined after the motility has been done, and the presence of large number of vital but immotile sperm, they may be indicative of structural defects in the sperm flagella, or this is also called the ciliary dyskinesia or Catagner's syndrome. And the image on the right top shows the 9+2 arrangement, which is seen for the cilia as well as for the flagellum. And the outer 9+2 arrangement shows the dynein arms, which are highlighted in green, and these are the outer and the inner dynein arm. In the image below is the image of electron micrograph of the flagella showing a normal 9+2 arrangement, and the other three images show when the dynein arm is absent, either both are absent or one outer or the inner arm of the dynein is missing. And a high percentage of immotile and non-vital cells, they indicate necrospermia, which is also an indication of an underlying pathology responsible for the non-vital cells. Next slide, please. This slide shows the preparation of the stains, and essentially it contains two stains, the eosin, which is a 1% solution, and nigrosin, which is used to add contrast. It is a 10% solution. Next slide, please. This slide shows some of the staining supplies, and the image on to the right shows a special porcelain slide, which is a 3-well slide. It's known as the Werner slide. Next slide, please. And this is the protocol where we place 1 drop of a well-mixed semen sample on the Werner slide, and we add 2 drops of eosin Y. We mix the sample and add 2 drops of nigrosin, and immediately a smear is prepared, air-dried, and ready to be observed under bright field microscope. Next slide, please. Here I would like to show you a video clip as to how this test is conducted. So we prepare the slide by providing the patient information, and we mix the sample on which the motility has been examined. We take 1 drop of a well-mixed semen sample and place it in the Werner slide well, and we add 2 drops of eosin stain and we mix it well. This is followed by 2 drops of nigrosin, which provides the contrast. And nigrosin is a very dark stain, so we have to be extremely careful that the stain is placed right in the sample and not anywhere else. The sample is mixed thoroughly, and then we take 10 microliters of the sample and place it on a clean glass slide, and we prepare a thin, uniform, feather-like smear. The slides are allowed to air dry, and they're ready to be examined. Next slide, please. The microscope setup includes the bright field microscope, We also make use of a 100x objective and a 10x eyepiece. The immersion oil used should be of a high refractive index, which is 1.52. And we also use the differential counter, which is shown on the image in the right, to count the viable and to count the stained and the unstained spermatozoa. Next slide, please. This slide shows that the sperm which are live, they will appear white, whereas the sperm which are dead, they will appear pink. Now, on many occasions, we will see a small portion of the neck region which is stained. This is called as a leaky neck membrane. And it is important to know that this is not a sign of cell death, and these sperm are scored as live cells. The WHO 2010 reference range for normal vitality is equal to or greater than 58% of the sperm in a normal sample. And this is an important diagnostic test in patients who are asthenozoospermic, or those patients where the motility is less than 40%. In general, the vitality should be equal or greater than motility. On the right, you see two images of a viable cell and a non-viable or a dead cell. Next slide, please. Here I want to illustrate a scenario. And in this case, a patient provides a semen sample, and upon examination, it is noted that the volume of the sample is very low, 0.3 ml, and it also has a very low concentration or oligospermic sample. The motility observed is 15%. The sample is spun and stained for the eosin nigrosin. When we score the slide, we find that the average vitality is 9%. Now, the vitality results are lower than the motility results, and we need to know what is the reason for this, because we explained that the vitality results should be equal or greater than motility. So in this case is an example of a poor quality semen sample where, number one, the semen volume is very low. Number two, the concentration is also very low, and the sample is spun. And that is the reason why this result may be inaccurate. And this inaccuracy can be seen in sperm with poor quality. Next slide, please. The next test for viability is what we call the hyposmotic swelling test, or the Haas test. And this test is done to check the viability of the sample without staining. And the results of this test show the swelling of the tail. The reference range, the reference value according to the WHO 2010 edition is equal to or more than 58% of the sperm which show tail swelling. Now I want to illustrate to you two scenarios which describe when we should use a eosin nigrosin stain and when we should use the viability or the Haas test. Scenario number one is if we are conducting a diagnostic test and the semen sample has less than 40% motility, we make use of the vitality test or the eosin nigrosin staining. The second scenario is when we want to use the sample for therapeutic purposes such as in ICSI. In this situation, the motility is 0%, and we will use the Haas test, which is not staining the sample, so the same sperm can be injected and the swelling of the tail will confirm that this non-motile sperm is viable. Next slide, please. As in any test, quality control is the hallmark of the efficiency of conducting the test and the validity of the results. So in this case, we have to also perform the quality control, and this involves the patient sample that is used to check the quality of the reagents. The motility is checked before checking the reagents, and this is conducted by using a new lot of the reagents and comparing with the existing lot to make sure that the new lot is functioning correctly. The vitality with the two lots should not show a difference of more than 10%. On to the right is the quality control sheet, which shows the lot number and the expiration date of the two dyes that we use, which is the eosin and the nigrosin stain. Next slide, please. The acceptability of the results is very important. And here I would like to give you another scenario where we count the sperm and we find that the average of the two readings is 17%. The two sets of readings are 22% and 12%, so the difference of the two readings is 10%. Are these results acceptable? On to the right is the table from the WHO 2010 edition, which shows what should be the average and what is the acceptable difference. So from this example, if we look, the average reading is 17%, and the difference that is acceptable is 8%. However, in our scenario, the difference in the two readings was 10%, and therefore these results are not acceptable, and this slide should be rescored. Next slide, please. This is another scenario I want to illustrate where the two sets of readings were 30% and 34% with an average of 32%. And the difference in the two readings is 4%. Are these results acceptable? Again, if we look into the table on to the right, we find that for an average of 32%, the acceptable difference is 9%. And this is matching with the difference that we are getting, which is 4%. And as the difference is less than 4%, these results are acceptable. Next slide, please. Sperm vitality is an important measure of sperm fertility. Also, we find that the normal sperm vitality is highly correlated with the normal DNA integrity. And this was documented by a study done by Samplaski and investigators, where they were examining the results of sperm vitality and the sperm DNA integrity, and they reported that normal sperm vitality is highly correlated with DNA integrity, and abnormal sperm vitality is correlated with a high DNA fragmentation. And this is illustrated on the image to the right, which shows the inverse correlation of sperm vitality with DNA fragmentation. And this correlation is very strong, negative correlation, as you can see in the box on the right. The correlation of 83% indicates that the sperm vitality is a good marker, and that can serve as a surrogate marker for sperm DNA integrity. And this is important for those labs which are not equipped with sophisticated equipment. And in those situations, the eosin nigrosin stain can be used as a marker of sperm vitality. Next slide, please. So I would like to leave you with the take-home message, and that is that the sperm vitality can be examined by the eosin nigrosin staining, especially in samples which are of poor quality. Eosin nigrosin staining is simple and accurate test, and the vitality results must meet the criteria for acceptability before these are reported. And the vitality results correlate highly with both motility as well as the sperm DNA fragmentation index. And viability can be examined by the Hoss test, and this test can be used for therapeutic purposes such as in ICSI. Next slide, please. So I want to leave you with a group picture of our ACRM team. And thank you very much for your attention.
You can connect with our program by connecting on our LinkedIn, and these are the benefit. Almost every single day, we provide update on our research activities by posting hundreds of research articles freely, completely downloadable that anybody can read. We also post the latest research which are presented at prestigious meetings such as ACRM, ASHRI, and AUA. You can learn about our virtual research opportunities, which we have just started. You can learn about our online training and opportunities to collaborate with our team. Just go to the LinkedIn and send a request to Ashok Agrawal, and it will from Cleveland, and it will come to us, and we will allow you to connect to our program. This is actually the best way to learn all the advances that are happening.
Thank you.